Welcome back to The Price of Business. I'm your host, Kevin Price, talking to you about you and your business. A big fan of the Association of American Physicians and Surgeons. I check out their website regularly, really making a difference and protecting the relationship between doctors and patients that have been so brutally violated by government and is continuously being so. And today I'm very excited to be able to visit with Dr. Jane Orient about Bernie Sanders' healthcare program, which is very similar to the type of single-payer program that they have in places like Canada and England, and maybe more like Canada, which is actually worse than England's, because at least in England you can go out and get private health care. You can't even do that in Canada. They just make it really hard to get private health care in England. And so I tell you right now, the way these kind of programs generally work is by rationing, which means people have to die off in order to make these programs affordable. That's how my grandfather passed away in England, arguably before his time, and it was because they literally told him it didn't make economic sense to keep a man alive who was no longer paying taxes. That's how socialized medicine works. So with that, Dr. Orient, welcome to the program.
Well, I think you've summarized it very well.
Yeah, that's the problem. But I want someone like you to talk about, tactically, because what we're talking about is a very sacred relationship. I mean, we're talking about a relationship between the doctor and the patient that's literally been torn asunder by everything from government to insurance, and that relationship is constantly violated. And your organization is one of the few that's really fighting this.
The problem is not just the government, and we don't really have much in the way of insurance. What we have is health plans. We have managed care plans, and all of them are facing this cost crisis, which is of their own making because they have just completely done away with any of the regulatory mechanisms of a free market where people have an incentive to judge the value of what they're getting before they spend other people's money on it. But the situation really is horrible even now as far as the patient-physician relationship is concerned. One patient that I know said he had a 20-minute appointment, which is really long these days, with his new doctor in the plan, and the doctor afterward called him back and apologized. He said, I'm really sorry that I didn't really have time to talk to you about what was bothering you, but I have to get all of these checkboxes into the electronic medical record or I don't get paid. Mm-hmm. Because all they really care about is complying with these rules and regulations, which are designed to mine data for the plan and to decide on your worth and to minimize the amount of money that's actually going to be spent taking care of you.
Mm-hmm. I want, and the tragedy there is that doctor would actually like to treat people. He never went to medical school with the idea of filling out boxes for bureaucracies, and be it government bureaucracies or health provider bureaucracies. And so it really is a constant strain. And a lot of these people, eventually we're going to have a hard time getting quality people. And my belief is that eventually we will never see a medical doctor in the future, unless we've been hit by a train or we're getting surgery for catastrophic diseases. We're going to be dealing with physician assistants before long, and only physician assistants because of what they're doing to healthcare.
Or if you do see a doctor, he won't be your doctor. He will be the system's doctor.
Ooh.
As one of our recent authors said, the system will see you now. Deliberately, there is no interpersonal relationship because, after all, if the doctor gets to know you, he might actually care about you, and he might be willing to put your welfare above that of the system, and that would be bad for the system.
Yeah, that's just it's a very sad reality. So what is your organization suggesting we do? Obviously, we don't need to go further along this trail. Bernie Care is full-fledged socialized medicine, isn't it?
It's supposedly Medicare for all, which is not exactly socialized medicine. Like in Canada, there is nominal ownership of practices by physicians in hospital, but total government control over what can be spent on what, who gets to provide the care, who gets to receive the care, and there's a huge bureaucracy deciding these things, it's always short of money, and there are always long lines for care. And Medicare has $42 trillion in unfunded liabilities, which Sanders, of course, has not mentioned. But how are you going to help that problem? By loading the rest of the population on this already bankrupt system is anybody's guess.
Mm-hmm. Yeah, no question about it. And the way these programs work, I know firsthand. My mom was from England, and she always sang the praises of socialized medicine until my grandfather passed away the way he did, and she heard, what my aunt said, that the doctors told him, literally it was an economic reason that he was allowed to pass away. The reality is that you're not getting the same quality of care in the market-driven one, and you're not getting, and you're certainly not getting the innovation that will come from a market-driven one, because you don't have the incentives for innovation. 90% of new technologies in healthcare come from the United States of America, and it isn't because we're so much smarter and so much creative than anyone else. It's because we still have incentives to make it.
Or there are fewer barriers. We're getting more and more barriers here as well. But it is true that Canadians tend to sing the praises of their system. There's always somebody in the room where I give a talk who says, I know somebody from Canada and they love their system, which they do. It's kind of like a religion for them. Their national identity is focused on this wonderful system. And they all pay into it, and they think, we don't have to worry about it if we get sick. But they're not sick. 95% of the population is not sick. You only find out about the situation if you are sick and you really need advanced care. And then Canada's discomfort is mitigated by the safety net, which is Buffalo, Seattle, Detroit, places like that are close to the Canadian border.
Yeah, and and then they begin to really realize it when they get that 4-year waiting list for a hip replacement.
Yes, and they can be in pain, they can be disabled, unable to work throughout that time. And some of them will just say, well, it's only fair that I wait my turn. But others, they decide that they don't really have to wait. They can go to the United States and get treatment.
Right, and so it has the same kind of social disparity that Bernie Sanders, rails against continuously. Except if it changes, where are they going to go now?
That is a very good question. Canada ought to be very worried because their safety net is about to be destroyed if Bernie Sanders gets his way.
Yeah, absolutely. So what is your thoughts? You're kind of an interesting group because you guys really don't have a problem with red meat, which, a lot of medical type groups tend to be kind of dignified or whatever. Your information is always informative, always factual. I consider your organization one of the most factual ones out there, but you're also incredibly alarming, which I kind of like that about you guys.
I think the situation is much worse than any of our politicians are willing to talk about. Medicare is bankrupt already. Its outgo exceeds its revenues. There is no way they can raise the $42 trillion to keep the promises. What they're doing already and what they're going to do more of is they're going to be ending the lives of people who really need medical care.
Yeah, no question about it. Very interesting conversation, very important topic with Dr. Orient. And what are some other things that you're doing to help wage this war to protect that relationship between the doctor and the patient?
We are really advocating and providing tools to help physicians get out of the system. I think that the system is just headed down the slope, and our only hope is to maintain a nucleus of independent physicians and patients who are willing to support them. Yeah. That a lot of doctors are opting out of Medicare. A lot of them are tearing up their managed care contracts, and they're going into a business where they work only for patients. And oftentimes their fees are amazingly reasonable.
Yeah.
That they may compare favorably with the co-pays that patients are paying to their insurance company. And the patients are saving these huge insurance premiums if they decide to go uninsured, so they can spend their premium dollars on medical care that they really want or need, or else save them instead of paying this huge monolith of health plans with all kinds of people who provide absolutely nothing that qualifies as patient care.
Yeah, no question about it. Yeah, we have a contributor on this program, Dr. Geetinder Goyal, and he started a practice that's like $80 a month per person for a concierge-type service, unlimited access as needed, so that he can really deal with the systemic issues. And that's not an exact quote on price, but that's pretty close to what he's charging. And it's a brilliant idea. I can see having a very high deductible insurance plan and having a relationship with someone like him to take care of your health care needs. And you know why he can do that? You eliminate the so-called insurance and you eliminate the government bureaucracy. That's how he did it.
Well, that is the way to do it. The problem is that there are very few true insurance plans available. Obamacare may have a high deductible, but the premiums are very, very high. So the people may be spending 10% or more of their income before their insurance plan ever provides any benefits. It used to be you could buy a high deductible, maybe $5,000 or $10,000 for a very, very low premium, and hope that you never had to use it. But the premium was kind of like your car insurance or your homeowner's insurance. It's something you pay and forget about. It's not something that's bankrupting you or driving you close to bankruptcy every month. But that's hard. I mean, Obama has made it even harder and harder for those plans to survive. And one thing we recommend is that people look into these health-sharing ministries. And if you look up Google that term, you'll find a number of them. Liberty Health Share is the newest one. Samaritan Ministries is one of them. Christian Healthcare Sharing is another. And these people are paying each month to help another family that has a medical bill, and it's exempt from the Obamacare penalties. And people are saving tens of thousands of dollars by going this way.
We've talked about it many, many times in this program. They are phenomenal programs. People need to look into it. Really own their health care. Very good. Jane Orient, Dr. Jane Orient. She's with the Association of American Physicians and Surgeons. That website, aapsonline.org. That's aapsonline.org. Thanks so much for being with us.
My pleasure. Thanks for bringing this subject up.
You bet. When we come back, more for you right here on The Price of Business.